South Carolina, like most states, dealing with hospital staffing shortages. Columbia International University trying to do something about that. News 19's Rachel Ripp has those details.
New buildings, new science programs, new students, and new professors. In the works for several years at CIU, but finally opening doors for class this week. And all in good timing to prepare future healthcare workers.
Nursing schools have been seeing a 3% increase in applications to nursing programs within the last 2 years since the pandemic. The average age of nurses right now is 50 years old, so lots of nurses will be retiring soon, and we know that that's only going to impact the shortage for nursing right now.
So when I graduated, it was just the height of the pandemic, and I definitely grew much more respect for the profession in general. Nursing is something that, as you can tell from the pandemic, it's needed.
As several nursing students have been put on years-long wait lists for programs, this one is offering open seats.
I had no idea at the time that CIU had a BSN program in the works, and the timing really couldn't have been more perfect when I sort of finished out the preliminary stuff and was ready to move on, but was faced with so many waiting lists and other things that were going to take a lot longer.
A little over 80 spots are available for freshmen through seniors. These programs also have the spaces needed: simulation centers for nursing and labs for science. Biomedical science also has open space. The Dean of Science Programs, David DeWitt, tells me there's no limit on enrollment right now, as they have tons of open seats.
Now that we have the lab, the health sciences lab, we're able to provide the facility and equipment that the students really need to get their hands on and learn those skills.
Reporting in Columbia, Rachel Ripp, News 19 WLTX.
And according to the university, both the science program's dean and nursing director are looking at expanding these programs down the line with offerings for master's and doctoral degrees. Now, according to the National Council of State Boards, South Carolina currently has over 89,000 nurses, about the same number as 2020, but there are 6,000 more registered nurses in the state than in 2020. Even though the number of licensed nurses in the state is higher than previous years, we are feeling the nursing shortage. The American Association of Colleges and Nursing projected that the nursing shortage will intensify as older generations like the baby boomers begin to need more care. We have nurses, just not enough to handle, they say, a higher demand.